How must the surrogate decide? First of all, who is the surrogate? Who is next in line? There is a legally designated surrogate, and it's the next of kin. In most countries, it would be first the wife, then adult children who are legally competent, then parents, and then siblings. Substituted judgment asks, what does he want? So what does the patient want? So if a patient is incompetent and the surrogate is going to decide, then this principle asks, please tell us, what does he want? Based on how well you know the patient and based on how well you know his values and preferences before he became comatose, before he became competent. So the idea behind this is we still would want to make an attempt to get it out of the patient. Unfortunately, he cannot. And so we look for the person who is closest to him, and maybe this person can tell us what he wants. Best interest standard asks a different question. It says, let's do what is good for him. Please tell us what you think is good for him. So the closest person to the patient and the patient who understands him would probably have the best idea regarding the stuff or the decision that is good for the patient. Notice that these two are different. One says, what does he want? Please tell us. And the other one says, if you want to do what's good for him, what do you want? Different countries follow these two in different ways. Sometimes equally, sometimes one is more weighty than the other. Now, nowadays, since in ethics and law, autonomy is very significant, or very heavy, or very important, very weighty, then if someone can prove or state what the patient wants, then it is much more important than what everybody thinks is important. So even if everybody thinks it's important because it's good for him. Just a few slides on certain things to be careful about, especially in very busy wards or charity wards or hospitals. Very careful when surrogates are not yet surrogates, when the patient still can think, decide, and express himself. Meaning, don't make the spouse or the next of kin decide. You should be asking the patient himself or herself. Not all family caregivers are surrogates. No earnest attempt to reach the surrogate. Now, obviously, just because there's someone beside the patient who's trying his or her best to take care of the patient, a close relative or a close family member, it does not necessarily mean he's the one you should ask. Look for the actual designated surrogate. Look for the spouse. Look for the children. Not all spouses or partners are surrogates. Be aware that nowadays we use these terms in different ways: spouses, partners, and such. As far as the law is concerned, the next of kin or the surrogate decision maker is the legally recognized spouse. Okay? So if people are living in, they might fall under a common law partner rule in some countries. You have to be aware that some of these laws do not contain things about medical decisions when the partner is incompetent. It might contain stuff about properties and division of properties and such. So just be aware of that. Be aware also that nowadays you might find live-in partners and one or both of them are already married but separated. But unfortunately, in places where divorce or annulment is very expensive, then they're actually not yet legally separated. So to avoid all these complexities, we advise that you review very well and decide who the surrogate really is. If there's any questions, then ask the legal office. And just to be sure, it's better to get the approval or the agreement of all the family members. Not confirming an old document. It's very important to confirm a very, very old advance directive document. Again, the most important idea is for you to do what they want. If it is a 5-year-old document, first ask them if it still holds, and then follow it. Just because it's written down, it doesn't necessarily follow that it's still what they want. Poor documentation, your worse versus theirs. Again and again, we've been reminded in training, if you're going to do something that's very complex, ethically or legally complicated, then document everything that you need to. Some doctors or providers would even ask family members to sign what they've written down.